I get to talk today to Mahima Tiwari at Power Heal. And since I was on TikTok and I got to watch her give some incredible advice on physical therapy, Ehlers Danlos, on pelvic floor health, that is for men and women, everyone. This is not just for you gave birth. This is important, especially as we are starting to get these lovely, beautiful silver hairs. I have been so psyched, and she's been very patient with me. So please welcome Mahima. We are going to be talking about so much from like how important physical therapy is, which I will scream this from the mountaintops. There is nothing better to everything that we might be able to possibly incorporate. Just a quick legal warning. She is an amazing physical therapist. She is not my physical therapist and she is not your physical therapist, but she can give some general, just sort of pointers. So
Yes.
welcome. I'm so happy to talk to you. And thank you for being patient with me while I was recovering.
Thank you. Thank you. I'm so excited to be here. I am so excited. I love talking about pelvic floor and hypermobility and EDS
You are a
mechanics
blast at
movements
parties,
and
aren't you?
more. So here we are. I'm excited.
You must be very fun at parties. Like, is that something that happens? Like, my dad was a therapist, and any party he went to, he got swarmed by everyone who wanted advice. Do you get that where, like, you go somewhere and they're like, "You know about pelvic floor," and someone just, like, lightly pulls you over towards, like, the drinks to talk?
No, whenever I go, I keep telling people like I bring erectile dysfunction like it's no big deal. And people are usually like, what the heck is she talking about?
I
Yes.
like you so
And we
much.
talk about clitoris and sex and fun and orgasms and yes, and I feel like people they laugh but they don't react, but hopefully they're like, oh, I have this problem, I need to go see someone.
I feel like, like, at my age, like, I remember back where we didn't talk about any of this. Like, I remember, like, my grandmother's generation, and they could not, like, even with prolapse, they would not have a discussion about this. Like, 1950s, 1960s was like, everything's fine all the time, we don't talk. And I'm so happy to see, like, my daughter's generation is like, "I'm on my period," like, yelling at her dad, like, this is what's happening right now with my body. I'm ticked." And I'm like, "I love you guys." Oh my gosh, like, thank you for
Yes.
talking, like, this is amazing. Because so many people used to suffer, like, I remember seeing, like, the Call a Midwife episode where they're like, they would knot flannels and then push everything up into, like, public health. Very
Yes.
important. So, can you talk to me a little bit about, like, where this passion came from? Like, the incredible need to scream out erectile dysfunction in a room, I totally get that, especially if there's, certain kinds of people in that room. I'm very happy to make people uncomfortable. What
Yes.
is it in your world that you're like, "We need to start talking about this because we do. It's really about not just sex, it's about your full health."
Yes. So so my why of why I got into public health is that I am from Nepal. So I was born a third daughter in my family. Daughters not wanted. So, third girl, of course, like I have been very passionate. Okay, my grandmother, I used to often hear my grandmother say, "You're the third born. I hope this is the last daughter in the family." So, yeah, starting very little, I guess I had a big passion for I don't know, I was a rebel. Like I was a rebel. I was very passionate about like I frequently talked in my social circles about women's issues. My father was a very sexist person, and I would be the first one to call him out always. So yeah, so this was in me. So when I grew up, I was like, I'm gonna be a. I knew when I was in grade 10 that I wanted to be a physical therapist actually, and then I was like, I'm gonna go into women's health. And then after I went into women's health, I realized, ooh, men. I mean, bad for them, but it's the first time they're not served. They're even not served as much as men, like the first time ever. It's like, okay, let me help them too. And this is when I got into into men's health physical therapy also. So yeah, so that's my why. My why is I was a unwanted daughter in the family and I was like, ah, we need to change that. What do I do? Yes, so that's why. Men, I was like, yeah, you guys are suffering. Let me help you too. So that's what happened.
It's very generous of you to, just add that in. I'm also curious about the how. I know nothing about Nepal except I would love to visit. Other than that, I don't know anything about the education system or what you need to do to get this certification, or if you got that. I think you're in the United States, right? You're
Yes,
in Maryland,
yeah,
and
I'm
that's
in
where your
Maryland.
husband is. So I'm really kind of curious about the how, is I had almost every upside to education to help, and I still had a really hard time getting through. I don't know what it's like in Nepal. I don't know what your journey was. I would love to hear it if you'd be willing. 'Cause I think there's a lot of people who can identify with the third daughter theory, even here and even just, like, people who are disabled, like, we're never what our parents dreamed of.
Yeah.
That's the hard and not never, I'm so sorry, I'm, like, giving very big generalizations. It is, definitely not the thing that I felt celebrated in my own family. Let me just bring that back to just myself. I'm not gonna speak for all families, but for my family, as much as they love me, as much as they tried to, like, not be scared, it was definitely a feeling of, "This is not what we ordered."
Yes. Yeah. I mean, well, even though I was kind of I wish you were not born kind of a daughter, but at the same time, I always got opportunities to study and do what I wanted to do. So that was always there. And then I did my undergrad back home, back in India. And then when I came here, I was like, I, back then I was just a general physical therapist. And I came to the US, and compared to Nepal, there are so many opportunities for career growth in terms of specializing in things, and this is why I did. It's not a very like it's a straight short answer. Like
No, it's
not
really a
super
cool
good, but
answer. Did your degree from India I've
uh,
had a lot of friends who've had degrees in other countries and come here, and they're like, "We had to redo everything." Like, everything had to get redone. Was that something that you had to do?
same here, same here. And then when
That's
I came
fortitude.
here, we had a lot
We
of
did this.
professional credit. So I had already practiced for a year as a physical therapist back home. And then I had to come and study college algebra again and American history because that would give me the highest amount of credits. And of course, I'm studying American. I know nothing about American history. And then I'm also trying to save as much money as I can and not go to a school. I'm trying to study everything by myself so that I can just give the exams. So, oh my goodness. My goodness. Yes, it was tough that way. It was tough that way. Yeah. So I studied everything: algebra, American history, world history, American governance, whatever yeah, and I studied all of them on my own. Yes, it was a lot.
I cannot imagine how exhausting that would be. History and American government and algebra is, like, my youngest is, like, starting college, and
Oh,
I'm like, "I can't help you. I'm so sorry." Like, we're past mommy's education. You wanna talk about Shakespeare? I'm here. Absolutely. We can talk history or literature. Algebra 2, we're out. Not possible. Can you just I'm really curious. I've always lived here in the United States, which is annoying, and I don't like that, but it is my reality. I don't necessarily know what happens in other countries as far as healthcare systems, and I would love if you could, like, just speak a little bit, like, on some of the countries you've lived in and the differences you've seen and how physical therapy is embraced, how, people are able to access care, and if there's anything that if you could wave a magic wand, you would change.
uh, eh,
That's not a short question, right?
well, okay. So, of course, physical therapy is in a very nascent stage in Nepal, which where it that's where I've lived most of my life, and then I also lived in India. So it's kind of nascent, but at the same time, it's also growing very rapidly. So, access to healthcare. Well, in America, what I've found is there are so many barriers, systemic barriers to accessing healthcare. Like you have to wait for 2 or 3 months to go see a specialist, right? So, back home, we pay for service as we go. It's like a cash based system, but it's not that difficult to get appointments. You can get appointments. But of course, like if I had a magic wand, my magic wand would say everybody has a physical therapy practice within 10 miles of where they live. And that's not true, right? No, that doesn't happen. Yeah, that would be my magic wand where everybody has physical therapy within a short distance. But oftentimes they probably have to go if it's the cities, they're they're very like they're very present. But if it's a relatively rural areas, you could have to drive an hour, 2 hours to get there at least. Yeah, even to get basic physical therapy services. But specializations, we are still working towards that. So
Yeah.
yeah, so because I wanted to, one of my goals in life is to improve pelvic health standards in South Asia. So because that's my goal, whenever I go back home, I try to conduct free workshops or sometimes like trainings to train the next gen physical therapists. So yeah, that's what I do.
That is so important and
Yes.
impressive,
Yes.
especially because I can kind of feel it from your vibe and your
Yeah.
energy, the
Yeah.
kind of physical therapist you would be, and having come from, like, really bad physical therapy to I now have 2 of the best physical therapists I can imagine. What is the thing you would like to teach physical therapists? If there's something that you wish that they would either, A, read and understand, or B, change in their how?
Yeah.
Note to self, do not push a pen lightly against your fingers. Okay, we're gonna put that hand over there. What would you want people to know, or even like diagnostically, what would you like people to start looking for if they're a physical therapist?
Number one, listen to your patients. Listen, 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 listen. Like they tell you everything that you kind of need to know. Like listen, most importantly, that's the most important thing I tell them. Communication is so 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 important. Validation is so 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 important. But then I also my line of work involves seeing people with chronic pain. So while I understand, like, of course, validation is necessary, of course, that's there, but also continuously invest in learning more. Like sometimes we physical therapists can have an air about, oh, I already know this. I already know this. Like if, for example, I also see people with Ehlers Danlos syndrome, and the traditional route of physical therapy where you're like, oh, graded exercise, where you're like strengthen, strengthen, it does not work that way. So I think we also have to have humility in
Mm.
understanding that if a patient says this is not working for me, patients are not making this up, or they're not just like malingerers, or just like sometimes I read up on notes and it's like this person has like, I forget the word for it right now, but it's like they're trying to say this patient is cuckoo. Like, they're just making this up, which is not the truth. So yeah, those would be my things, like communication, humility in the need of learning. We all need to learn, and validation. Always knowing I don't know this as much as my patients know. They live in this body day in, day out.
I think you just heard a whole bunch of Ehlers-Danlos patients cry with that last statement. Where do you think that physical therapists and other medical professionals can go for good information on Ehlers? Where's your sources for Ehlers-Danlos? Because it's there right now. There's only one protocol that is out there, which is the Muldowney method. As far as I know, I could be wrong. It's been a while since I've researched it, and I failed at it at least 8 times. I've tried 8 times to do this Muldowney method, and every time it is an act of humble. It absolutely retrains my ability to feel humility. Where do you go for ways to work on Ehlers-Danlos? Where could physical therapists go? 'Cause they're just starting to hear about it. Like, I'm just starting to not have to ask my doctors and physical therapists to Google.
Yeah. My primary source of information has been through conferences, through the Ehlers Society. Like there are courses that you can take. They're really accessible in terms of money.
Mm.
And my journey has been, I have not been focused on just looking at it from a physical therapy perspective. I've tried to attend courses. These are usually like 1 hour courses, like you just commit to 1 hour a week for a few weeks and you learn on the overall manifestations of EDS. And yeah, that's been my number one source. From that, it has opened doors into like connecting with like minded providers, talking about what has worked for them. It has also been like getting trained in pain free manual therapy, not cracking and popping the joints. That's not manual therapy. Manual therapy should always be pain free. We're always looking towards desensitizing a sensitized nervous system, making sure the brain feels it is safe to let go of the tension that's holding the body. And again, this is not to say it is just in your brain. It is to say, can I give this patient a relatively pleasureful input? I mean, pleasureful, not yes.
You're not that podcast, at least
Yes,
not
yes, we're not. Though
give
I'm a
it
pelvic
another 20
PT,
minutes.
yes, and make sure their muscle system reacts and kind of loosens up and lets go and carries less sensitivity in itself. That's how the approach of manual therapy should be, according to me. So yeah, it's been like working on like different.
What are some of the techniques that you do to do that? Because I'm like, I know when I go in and there's like an arm hanging out, and
Yes.
I'm like, I don't know how not to guard that.
Yes.
So what are some of the ways that you short circuit to make people feel safer when they're in physical, like, and everything in their body is like screaming, "This is not right. That bone, that's not where it's supposed to be. That's a creative expression.
Yeah.
I did not give my skeleton permission to do."
Yes. So my approach is usually the things that have worked for me are like the concepts of something called as visceral mobilization. This is
Mm,
where you work on soft tissues surrounding the visceral organs, but the concept is you provide gentle, non-painful touch. You help the tissues move on all degrees of motion, and the body magically starts to unguard itself. So it's the concept of visceral mobilization that I usually use, and I also use techniques from pain science education.
mm.
And not to say that this is in your brain, but to say that brain is sensing a lot of danger and let's let the brain know we're safe right now. That kind of concept. Yeah. So pain science education where I just gently touch the body and make sure the nerves glide where they want to glide and let the patient's reactions and experiences kind of guide me into where they want to be touched, how they want to be touched, and build into their tolerance to light touch and light stretch and deep stretch and things like that. So yeah, there's not one perfect technique that way. It is usually having the patient lead by you giving gentle manual support, touch, and ask them how they're feeling, and then go accordingly.
It
Those are
sounds
the
like you're
concepts.
working more in a partnership than in a the traditional idea of what a doctor is, which is, "I know what's going on. That is spasmed. I need to push in on that spasm as hard as possible, make it stop, or I need to yank that bone back into its socket."
Yes, exactly.
I like the collaboration a lot more. It sounds a lot less, soft tissue damaging.
Yes, yeah, collaboration in every part of physical therapy. At the end, like I'm not your boss. I'm just here to guide you through this, and you know your body better than I do. Honestly, it's easy. Like as cliche as it sounds, that's the truth. And And yeah, it's not about me giving you just like go 3 sets of 5 of this exercise. Just do this. No, it's not that. Let's collaborate. Let's talk about techniques that you can do yourself so that you build a self-reliance. Like if you're coming to me as a physical therapist for 5 years once a week, I'm not doing something to empower you. Like, let's find things that work for you and how you can empower yourself to get rid of a flare up whenever it does happen. So that's the whole process of health should be collaborative. And this also extends to people with chronic pain, which involves chronic pelvic pain and Ehlers-Danlos hypermobility spectrum disorders. Yes.
Some of, like, the symptoms that you started, like, especially when you just first started as a physical therapist, what were some of, like, the symptoms that you're like, "This is adding up to something. I'm seeing a lot of this."
Now that I reflect back,
Here I am telling you.
I'm like, wow. Of course, there is so much I still don't know now, of course. But now that I reflect back, I'm like, wow, there used to be this patient who used to tell me this is not working. And I just thought they were not being cooperative with their home exercises.
Mm.
Like it's like I would as a physical therapist who just started out, I would just apply the principles of just go for it with 2 pounds today. Let's go with 3 pounds the next day. Let's go with 5 pounds. Let's make you run. Let's make you jump. So 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 I was like, okay, this is one group of people where these general philosophies are not working. Then I had a patient who had endometriosis and they had an endometriotic surgery and I was like I was doing everything that I knew from a pelvic floor perspective, right? And then they would kind of get better, but things were not making sense. I'm like, this is not making sense. Something's happening. They tell me like I also have a headache. I'm also having back pain, and no matter what I would do, that pain would kind of get better and not get and like not have a real tangible different session through session. And this is when I was like, ooh, there's this group of people. We're not something's not working. My traditional techniques that I have in my tool bag, not making the cut. And this is when one of my patients actually told me they have EDS. And then I was like, okay, let's see what this means. And this is when I went through the rabbit hole of EDS. And then, oh my God, and then I was like, oh my God, I'm sure this person probably had some parts of this. I'm sure this person probably had some parts of it. I feel so bad. I felt, I was like, wow. I didn't know this. I didn't know this. Yeah, so this has been
I
my
called,
trajectory.
like, every past doctor, everyone who was, like, desperately trying to figure out the puzzle of me, 'cause it took 30 years for me to get my diagnosis, and I called them all, I'm like, "Letting you know,
Yes.
if you see this again, this is what I have, just don't make them suffer for 30 years trying to figure it out."
Yeah, yeah. And thank you for doing that, but I I wish it was not your job to do that.
There's so much about the medical
Yes,
community that I wish it wasn't my fucking job, because it should be my fucking job to, like, make sure that I can afford to see a doctor,
yes,
or that I can't go to the hospital to find out if it's POTS or a heart attack, like, so much. I'm
yes.
so tired of talking to my insurance company. I cannot AI, you wanna make AI useful? Make it so I don't have to call these people. I want an AI bot that handles my medical bills and handles, like, for insurance, they can just the bots can talk to each other.
That
That's
yes.
that
Oh, apparently there is a
yes,
you did you hear that? Okay, you know what I'm trying to say.
everyone, because it's the funniest story. I was like, I can't. I think we got like the Skynet wrong. I think that the end of the world is just bots being mean to each other
Did
on
you
the
talk?
internet.
Yeah, apparently they're talking to each other.
Yep, they're having full conversations. One of them was like actually reached some level of sentience, and I'm like, cool, cool. This is fun. Do you see the gray hair? I watched every movie about this from like the 80s on. It's not like we weren't warned. Arnold said so. But if AI can be like, like AI, it does have some incredible uses in the healthcare industry. I don't want to minimize the amazing things that guardrailed AI can do. Now, generative
Yes,
AI can go fuck itself,
yes.
but actual guardrailed AI, like these are the things I was hoping it would do is be able to make my life easier by handling the health insurance and being like, you denied me life-saving care. I mean, I'm sure like for you, if like guardrail AI could write your notes for you,
I would
and,
love
like,
that.
give you more time to research, more time to be with your family, more time to and you didn't like, my poor physical every time I see him, I'm like, "Do you want me to stretch your fingers?" Because he's like this, like, for
You
all
see
the
me
notes
also
he's
doing
writing,
yeah.
like I'm like, "Dude, you've got a kid at home. This is so much
Plus,
hurting."
my mom also thinks that the pictures and the videos that she sees of a horse flying in the air, she thinks that's not. She thinks it's real, and I
Yeah.
didn't want to take that joy away from her.
My mom's in her 70s, she's lovely. She does still have some really good like, her critical thinking is amazing. But, it's like, "Okay, so we need to talk about the sweater that you just saw on the internet." There's no way. That's just not I'm sorry. I'm sorry, ma. It's not but when we get, like, the healthcare
Yes,
information and we're getting videos where it's like, "Oh, this got cured," or "This is close to being cured," and, like, I don't know if that's true or not. It's
yes,
getting
true.
harder and harder.
Yes, yes.
But there is some good research coming out of England about Ehlers Danlos, which is interesting about the fascia and how our bodies conduct electricity, and because we're always in a full-blown spasm, how that affects how, like, things go around our bodies. At least something's getting researched. I'm just
Yes, yeah,
like that.
yeah, and yeah.
So I wanna know, aside from your amazing personality, which you are so comfortable to talk with, I'm really hoping you're forgiving my brain fog today. But what I'm really interested in, aside from you are just the easiest person to chat with, do you have any ways of getting people to talk about the things that maybe like even though this generation seems easier to talk to, you're probably seeing people who aren't in like a younger generation who are like, yeah, I don't want to talk about that. That doesn't go where it needs to go. Or every time I sneeze, I pee. There's how do you get people to feel comfortable enough to talk to you and also acknowledge that it's not something you just shrug off and go, well, I guess that's just another thing wrong.
Builds trust. I mean, patients know. Patients sense everything. Patients sense. Patients know if you really care or not. Like they do know. So yeah, be genuinely curious. Validate. Tell them don't. I don't know this. I don't know about this too much, but I will see if I can figure this out. And yeah, and look like you're not just look like and be open to the feedback that they give you. They're like, okay, at some point they're not comfortable about this. That's okay. Like you can tell them if there's any time you feel safe to talk to me about this, let's visit that. Yes. Or follow up. Ask, these are the things that we're doing. What's making sense to you? What's not making sense to you? How can I make our sessions better? Yes. Yes. And when they do tell you, don't gaslight them.
Yeah, that would work.
Yes.
Yeah, I would absolutely be willing to open up after that.
Yes.
Are you the physical therapist who, when someone comes in with a new diagnosis of Ehlers-Danlos or pelvic floor issues, are you the first one to bring up sex? Because I have yet to have a physical therapist. No, I had one. I did have one. And she was like, she brought my husband in and she was like, letting you know everything she said is for real. Your disorder has a 60% divorce rate. You better not fuck this up. Sex is going to be something that is a stretching activity with meds planned and pillows. I loved her. My husband, she immediately stopped me. He's like, I already do 80% of the housework. There's no way I'm ever leaving this woman. Just went straight through everything. She's like, okay, so do I get to like make you come in to teach the other husbands? That'd be great. That's amazing. But that was the only time anyone ever brought up sex. And that was a big part of like, I don't know about anyone else, but that was a big part of my life. And now it was getting more complicated with dislocations.
Yes.
Really, nothing kills the mood. Like, hey, where's my femur?
Yeah, exactly. Yes, exactly. Yeah. And
Sexy is where's my underwear, not sexy is where's my femur.
fair enough. Yes, sex is not my drink just came.
Popping and snacking is not supposed to be in my joints.
No,
I saw God should be an orgasm, not, oh my God, my pain just hit a 10.
true.
We can do this all day. This will be
I love that. I love that. Usually, yes, I am kind of the first one. Yes.
good. I'm so glad you do.
Yes. Yeah, I do ask everyone. And I also move with the patient's speed. It's like
Mm.
I also specialize in pelvic floor physical therapy. This is what your pelvic function looks like. Are you comfortable talking about this? So yeah, I usually ask them. I I don't make too much of what it is. I don't make it to be too big a deal versus or too small a deal.
It shouldn't be too big or too, it's just a part of human life for a lot of people.
Correct. Yes, and that's it. So that's what I ask. I tell them, "Are you comfortable about talking about this?" If they're not, they're not. If they are, we talk about it. Yes.
If anyone is unwilling to talk about it and needs a little advice, I will just say a buckwheat pillow
Mm.
is fantastic for setting up and stabilizing a joint. And those C-shaped pillows like that you use to like I've I'm not gonna get graphic. I'm not gonna embarrass my husband like that. He's way nicer and sweeter than I am. But those are things that are very helpful to buy. I don't know if you have any products that you're like, you know what, I'm not giving anyone particular advice, but these are things I've noticed help with either bedroom or other things that you're like, you know what, if you are someone with Ehlers-Danlos, you might just check that.
Like you said, support. Whatever helps you support your joints as much as possible. Lots of lube if we're talking about fun times.
Mhm.
Eat, ice, whatever makes sense to you. Yes.
Yep.
Yeah. Yes.
And all that can be fun, everyone. Also, there's a really
And most importantly, also invest time in foreplay and arousal on other times, not just in the bed, even other times, like not just genital touch foreplay, just
it's like
romantic
almost like think
time.
back to being a teenager, holding hands, like all these there's so much stuff. Like I'm not just talking holding hands, but I'm not gonna get graphic here either. Sorry, everyone. Too tired. My imagination cannot go there. But I'm just saying, like, everything does not have to be the one thing you saw on Stars or on, it doesn't have to just be 1, 2, 3,
Yes,
pow! Like, there's so much to explore.
correct. Yes, correct.
Yeah, just
Absolutely. I'm with
making
you.
out is good. Have
Yes,
fun seeing where things go.
yes.
Also, there's a Sealy's thing that you could put over your mattress that gives you a full body heat, which is amazing. If you're starting spasms in your lower back and it's $90 and it just fits right over the mattress and it's a full body heating pad.
Ooh, nice.
Yeah.
What's the
And
name again?
it's, from Sealy's. I'll send you the link.
Cool.
I'll put the link in the show notes too. Just because, oh my God, like, even just, like, if you have a spasmy back at night, like, anything, it's lovely.
Yes, 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 yes. But then I also want to say if you are somebody who has EDS and is dealing with pain with sex and like pelvic floor issues, it might also be because of mast cell activation syndrome, which is a very
What?
common, yes,
Yes.
yes, yes,
What?
yes, yep. So there are mast cells in your bladder, mast cells in the vulvar tissues. Yes. Of course, all of this, but also medical management, somebody who knows all of these things.
Wait a minute, I've been diagnosed with this for, like, let's see, I'm almost 50. I've been diagnosed with this for, like, almost 20 years now. This is literally the first time I've heard this. Like, I swear having Ehlers-Danlos is like being a woman, where it's just nonstop. I'm sorry, what? What? That's gonna happen now? What? Like, I remember when I told my youngest, like, periods, and it's like, "What? Mm-mm." I opt out, right? Right? I can opt out. Like, same with Ehlers-Danlos.
Yeah,
It's like a nonstop, "I'm sorry, what?" Like, you can have this disease for 30 years and you're still like, "That's a thing?"
I hear you. Yeah. Most times, even me as a clinician, I'm like, oh my God, what don't
Okay,
they
so
go
tell me about
through?
the mast cells in the
Yes,
bladder, 'cause I am guaranteeing you someone out there is like me going, "I'm sorry, what?
yes.
I thought this was because I had 2 kids, and this is just how this is. Please tell me about mast cells in the bladder and what that causes."
So yeah, so our our bladder can also have mast cell, also has can have mast cell sensitivity whenever you have chronic urgency, frequency of urination. Yes, if you're somebody who has pain with sex, it's frequent infections in the bladder, in the vaginal area. It might also be because of mast cell activation. So
I'm
yeah.
sorry, the look on my face has nothing to do with you, it's just I had that happen chronically for about 5 years in my 20s, and they were going to give me a shot to numb the interior part of my vagina. They were going to do a numbing shot because it was so painful to pee or have sex or do anything in my 20s, and, like, I am so mad right now
Yeah,
hearing this,
yeah.
not at you, but oh my gosh, like, I never had that done because, like, saying Emmy was like, "Don't you dare," and, ended up clearing up after a while, but that would have been good to know, those some
That would be good to
antihistamine.
know, yes. Again, mast cell activation, of course, but also hormonal contributions to those issues important to think about. So yes.
Well,
Yeah.
at least it kept me a little safer in my 20s than I probably would have been, but still.
You're right to be angry. It makes sense. It makes sense.
Existential feminist scream. Okay, good, we're
Yep.
fine, it's all good. So one of the big things that happens to a decent amount of us is that we might give birth, we might have a cesarean section, especially if we have Ehlers-Danlos, that's going to be a very different kind of recovery. Is there anything that worked really well for it? Not giving anyone medical advice, but is there anything that you're just like, "Gosh, I was really happy I told my patient to do this directly after?"
Mm, if I'm talking about considerations for EDS and pregnancy, I mean, pelvic floor physical therapy, I can't even tell you. Like, pelvic floor physical therapy, it's going to change your life. After baby, please, if you can, access pelvic floor physical therapists. Mm, constipation is so prevalent in people after having a baby, but of course, like people with Ehlers-Danlos and constipation can cause pelvic organ prolapses. And with the connective tissue disorder, with people with EDS, they're more susceptible to getting pelvic organ prolapses. So pelvic floor physical therapy, if there's one magic thing, I'd be like pelvic floor physical therapy, please. Yes.
I I cannot scream from the rooftops how important physical therapy is. And when you're talking about, I want like a physical therapist on every, I wish,
Yeah.
because even if you're healthy, you want this. Like, even if you're like, hey, I'm doing great. I'm 30 and I'm running marathons and I cold plunge. Please. Anyway,
Yes.
sorry. That's my own little vibe there. But like, I worked in the Silicon Valley for a very long time. I have an allergy to the bro culture.
Well,
But, like, even the healthy people, like, my mom is one of the healthiest people I've ever met, and I made her start doing bridges and bird dogs. I'm like, "All I need you to do is just 10 bridges, 10 bird dogs in the morning.
yes.
That's all I'm asking for. Please just do this for your child." And all of a sudden, she was like, "I'm not like, the everything's, like, not." I don't wanna embarrass my mother, but, like, she's like, "This is significantly better. This has been an issue since you were born. Oh my gosh, this is getting better."
Yeah.
And she's like, "My back doesn't hurt when I'm gardening." And, like, it's like these little like, you think that you're going to the gym and you're staying strong, but there's some very specific movements that it usually like, even with Ehlers-Danlos, I'm still, like, working on this, and yes, there's days I can't do a bridge, but physical therapy is one of the most important things you can do to increase your mobility through your age, like, even if that's all your goal is, like,
Yes. I may be
all.
biased, but 100% agree.
And there's just research on people who had, was it hip replacements or knee replacements, where they did a double blind study. Some people got nothing.
Mm.
Some people got physical therapy. Some people got the surgery and physical therapy. The physical therapy group was the one who did significantly better in the study.
I mean, probably there are
Yeah, I was just like, this is
few
so
studies like, yes,
great.
yes, yes.
Yeah. So I've been like, yeah, I'm making like everyone in my life go to physical therapy. I'm like, I'm so sorry, everyone. This is just what you
Yes.
have to do.
Yeah. True. Yes. True, true, true. Yes.
This is just me. I have never met her before. I stalked on social media for a while on TikTok because all of your advice was losing you was, like, one of the hardest things of, like, getting rid of TikTok because I used to watch your videos, like, every day. I'm like, "Oh my
Oh,
gosh," and I would incorporate some of the stuff you talked about, and I was like, "This is actually really helping." So I miss you because I'm not on TikTok
but then
anymore.
I'm also on a social media hiatus, and then I'm like, so I think
Smart.
yes, I have to go back, but I'm not right now.
There's well, we can talk later, but I think
Yes,
there's ways you especially for your business, you could do this in a way that would keep you out of, like, insanity of social media. But yeah, I definitely feel you. This is a weird world, and, like, being a woman on social media is a
yeah,
very different
yes,
discussion, especially a woman who's knows what she's doing.
yeah. Uh, Yeah, I know I was just overwhelmed with the world. Like it was just too overwhelming. Now I'm just gonna say. So whenever the news about Jeffrey Epstein and all the doctors and physicians, all of the involvement of gynecologists, all of this came up. I don't know. I just felt like I feel bad for I feel anger about one, of course, all the people, but healthcare for personnel, that's like next level of anger. So I don't know. I just felt like very defeated. And I don't know. I was like, I need to take a little break for a while. Like it got overwhelming after a while.
Makes so much I mean, social media is overwhelming. It's like, here's a puppy. Here's the end of the world. Here's something you should do tomorrow. Here's something you have to do right now. Here's how you could save everyone if you give up everything. And then here's a puppy. And it's like, I'm done. I'm gonna go curl in a corner and scream. And then here's your worst trauma
Yes,
done on a global scale.
yes,
Like,
yes, yes,
yeah, as anyone who's a survivor, I think all of us who have survived, SA and everyone who's been around this or helped someone heal from it, like, I think all of us are so chronically traumatized by this experience.
correct. Yeah, so that's what happened. So it's just like I
And when you're working with pelvic floor, I'm sure this is also an issue you are working on, especially with pain and guarding. I know for myself, like, anything has to be done in, like, the whole vaginal area, I, like, seize up and I'm like, "No, no, no."
Yes, exactly, exactly. Yes, I was kind of reminded of my patients. Like the logical part of me knows that of course I can make a difference, but the emotional part of me is like it's too much
Mm.
to do it. So that's why I'm like, okay, I'm just gonna take a break. I'll get back when I can.
What are you hoping to show people on social media? What are your goals for social media?
Help people understand EDS and get at least some sort of credible information, hopefully. Like there are millions of information and at least hoping I can at least provide some evidence backed information because just anyone can say anything. Like you can say
That's so
anything.
true.
Yes. You could say anything. Sometimes I hear people I'm like, wow, why would I do this for people with EDS? Or why would I say this to people with EDS? And I can't rage comment on other people's profiles, which I'm so close to doing on sex at some points. But then I'm like, okay, I could be the antidote to this. So that was my hope was to be the antidote. But of course, the whole world situation is like, it's too much on me.
I think one of the things that's so amazing about your channel, was that it sort of healed me in a way of just hearing a medical professional talk the way you do. Like, speak of respecting patients and talking in this kindness, especially when on TikTok, I had just gotten into a massive argument with a nurse about, like, that whole thing that went down about at the gynecological center where
Yes.
they had photographed the paper and I had just gotten through, like, a moment where my post went viral for 300,000, like, whatever, people had a lot to say about that, especially nurses, and it was, like, so beautiful to hear you talk about patients like you like them, like you want
My patients.
like you're not judging them as they walk through the door, and it was, like, first off, great information, secondly, just hearing a medical professional speak like that was healing, like,
Yeah.
it was calming.
Thank
So,
you.
thank
Yes.
you.
Also, again, another good thing about being on TikTok is sometimes like my patients give not patients, like my viewers give me such helpful perspectives, and I learn so much. Actually, I do. Yeah.
And again, like, if you don't have this body, it makes no sense. Like,
Yes.
even if you study these kind of bodies, each one of us is very different in how we present, but also we don't know what to expect. Like,
Yes.
second to second, we have no idea.
Yeah.
What's your ideal situation where someone comes to you? What do you hope they've either researched or started, or do you want them to come in with a diary? Like, what would really help you the most with a new patient?
I mean, this does not have to be the first session that they're in, but I usually have my patients, if they have these spoons to give me a short summary of how their days are. Like usually how much, like I see long COVID patients, I see chronic pain patients. So usually I want to know what's sparking joy, like what's helping them feel like more present with their body. So I want to kind of know those stuffs. So yeah, so I usually have them like just do a small journal, like just each day, this is how I felt today, this was how my day was, this is what helped me feel happy, this is what helped me move. This is not working for me. Just a journal, like until they see me the next time and we discuss all of those things. So, and again, it does not need to be the first time that they come in. Yeah, but it's something that we continue to work on.
So we're getting close to an hour, and I do have to go pick up a small human. What, aside from me jumping on an airplane, which I would probably will be like researching flights, what, how can people work with you? Do they go onto your website? Your blog is amazing, by the way. So if you're missing her from social media, there is a very good blog. But how do people work with you? Can people work with you via Zoom if they don't live near you? How if you're
You
not on the East Coast?
got you.
Or if you're on the East Coast, absolutely super easy website, we'll have a link on our show notes. But if you're not, do you do Zoom appointments?
No, actually not. I have not researched into the legalities of this portion. You're just bringing this up. I've not done. I'm not licensed in certain states, so I've not researched that. So no,
Okay.
I don't do.
So
It's usually in person.
go see the beauties of Delaware, and well, I cannot thank you enough for being so generous with your knowledge. Even if even if I have to wait to be able to pay you by when I can fly out, you are amazing. I'm really grateful to get to know you. You really do reaffirm my belief in public health officials.
All right. Yes, I am so thankful for giving me this space. For anybody who is chronically ill and listening to this podcast, I want you to know that I'm sure this sucks for you, but hopefully there are providers who there are providers who listen. And I know it is exhausting to go so many providers. Usually that's the story of each of my patients, and then find one person that you like. But I hope I hope we exist. I I'm sorry
There's
to
more
go
of
through
you
so much.
now.
Yes. Yes, yeah. You guys go through so much, and a nice provider is committed to making sure you get better and you have a fulfilled life with the best thing that we can do, like a fulfilled life, a joyful life. Life is all about finding joys in the circumstances, I guess. So yes.
I cannot thank you enough for your time. I hope that you come back on the show anytime you want to discuss anything or there's something new to talk about. This is such an underserved area, especially pelvic floor health. I'm so grateful that you're willing to talk. Thank you, everyone. We're trying to put out 2 episodes a month now. Wish me luck. All of our interns found jobs. It's just me. Be very patient with me, please. So be kind, be gentle, and be fierce, whatever that looks like to you. Have a good month, and I will go and deal with this small pug goblin that has decided to snort through this entire episode.